Welcome to another episode of the Better Dental Life podcast. I'm so excited to have my guest here today, Rachel Wall, who is an international speaker. She is a coach and owner of Inspired Hygiene. Rachel has guided thousands of dental professionals to elevate their hygiene services and their systems to help drive profits. And the bottom line, just developing empowered and engaging hygienists. So I'm so excited to have you here, Rachel. Welcome to the show.
Thank you. I'm happy to be here.
Yeah, I want to just start to maybe help you introduce yourself
Okay.
to our listeners a little bit. So tell me, how did you get to Inspired Hygiene? Where did this start and why
Yes.
this?
So I do not have the story of, I fell off a horse when I was 8 and just fell in love with dentistry. It's not like that. I was a community college student and the daughter of a very industrious mother, single mother. And so, went to community college for about a year and she said, "So where is this going? What's next? Because you're going to need to either start paying rent, get a real job, or figure out what's next." So I knew I was interested in the healthcare field, had applied to nursing school, did not get in. And so I was trying to figure out my next step, and I happened to have a hygiene visit. And honestly, the rest is history. Like, that
I
is
love it.
really where it started. That hygienist recommended the school that where she went, which was about an hour away from where I was living at the time. So I did that. And then I had a friend whose mother worked in a dental practice, so I started there. That was my first job as a hygienist, and then started Inspired Hygiene in 2004. So we are celebrating our 20th year this year.
That's amazing.
Yeah, yeah,
Congratulations. That's exciting.
thank you. And before that, I was really fortunate to be in a practice when I went to dental hygiene school at a community college and worked for a little while, and then went back and got my bachelor's degree at University of North Carolina in Chapel Hill. And while I was there, I was in a phenomenal practice that was very progressive. We were one of the first practices, if not the first practice, in a very progressive town with a huge dental school. One of the very first practices to have digital X-rays. So that was kind of the beginning of, technology in my career in dentistry, and then also a practice that really utilized coaches. And so I was introduced to that, fell in love with the concept, didn't know really what I had to offer at that point in time, right? I'd been a hygienist maybe 6 or 7 years at that point. And, but then just kept learning and kept, putting myself in positions to be mentored and grow. And so that's what happened, was hired by another hygiene coaching company. They took a different turn, and then I started Inspired Hygiene, and here we are. Yeah.
I love that.
Yeah.
So tell me a little bit about Inspired Hygiene itself. So what do you do? What services do you provide? How does
Yes,
that
thank
work?
you. So we are a coaching firm that specializes in helping dental teams elevate their hygiene services, the systems in their hygiene department, to create a win for patients with better patient outcomes, providing hygienists a more engaging um, place to work that is constantly, growing and evolving and giving opportunities for learning. And then ultimately is a win for the practice as well, with greater hygiene profitability, hygienist consistency between hygienists with diagnosis, handoffs, systems, all of that, just creating a thriving hygiene department. So we really love to do that. And I'm really blessed that over the last 20 years, we have grown to, we have five coaches that are all hygienists. I'm a hygienist of 30 plus years. So we have five hygienists that are all coaches that go out and work with our clients. We also have a support team. Almost everybody on our team is either a hygienist or a dental assistant, with the exception of just a couple people that are in like our back end website support and marketing. So it's really cool to work with
I
folks
love
that
that.
just love our industry.
So when a dentist decides, okay, I need some help with my hygiene department
Yeah.
and I want some help to get more engagement um and more out of hygiene and they approach you, what does that look like? Do you and your coaches go out to the office and kind of
Yeah.
do an evaluation? How does that
Yes.
work?
So first we have a conversation. Just have a conversation with typically the practice owner or practice administrator to see what do they feel like are the strong points in the hygiene department. We want to know that for sure. And where do they feel like there is room to grow? And grow doesn't always mean more patients, right? Grow can mean grow in our understanding of the impact that hygiene can make, grow in how we're implementing that impact so patients get better outcomes, grow in our systems and our consistency. So we have a conversation. Once they decide they're ready for coaching, we have a couple different options. One of the first steps in our coaching program is to do what we call the hygiene growth roadmap, which is an analysis of the hygiene department. So really reveals to them what is working well from a analytical standpoint, and also what are the growth opportunities. And that's all done virtually, but we really dive pretty deep into the hygiene department, even looking at charts and documentation and diagnosis consistency there. And then yes, our coaches go out to the practice. We still are there hands on. We're observing. We're doing clinical calibration, really getting the whole team behind hygiene in implementing, refined systems and just helping them be the best that they can be.
Yeah. So I want to talk a little bit about, and so maybe you can think a little bit about this, but um there is, there's always a stimulus that's going to have somebody want to reach out to you.
Yeah.
Like there's something and there's a reason they're going to come out. There's a
Yeah.
reason they reach out to me as a coach as well. And usually it's financial. And so so there's a stimulus, but it could be
Yeah.
cultural.
Yes.
And then there's a result they think they want, and probably what they think they want you to do to fix their hygienist, right?
Mhm.
Like they have
Mhm.
like a little bit of agenda, but that
Mhm.
probably shifts. And maybe there's an education as you go in and you see, hey, here's really what's going on. So
Mhm.
what would be like some typical reason somebody reaches out to you? What do you find are people stimulus? And then what do you find when you go
Yeah.
into the offices?
Yeah. Okay. So I just spoke with the dentist this morning, and it's a great example. So one stimulus is they've tried to work on this on their own, and they've gotten as far as they can go. Either the dentist has run out of time to manage, or they've seen some progress, but they know there's a lot further to go, and they feel like they've exhausted their DIY approach. So that was this dentist's, situation. He's like, we've talked about this. We created a kind of a sketch of a perio protocol. We have one hygienist that's really running with it, and then we have the others that are not. So how do we bring everybody up to speed? And he said, I think it's
Mm,
just going to be better coming from another hygienist that has experience. We also bring evidence-based, care and evidence-based resources to back up what we're recommending. So that's always very helpful, right? For them to say, oh, okay, this isn't just, Inspired Hygiene showing up with this made up protocol. This is actually based on science. And then another stimulus could be, like you said, financial. Maybe they're meeting with their financial planner, and the planner is very thorough and is looking at all the parts of their business and seeing, hey, I noticed that your hygiene production is stagnant over the last 2 years, even though you increased fees. Or they're looking at the profitability piece of hygiene saying, okay, I know you've increased hygiene wages by 15%, but the hygiene production hasn't increased by 15%. So, where are there opportunities to even just tighten up some systems, just create that awareness again around what is our goal for being here with our patients? What and are we meeting that? Are
yeah.
is the practice in the hygiene department specifically meeting the core values that sometimes are publicly put out to their community on their website? I use that as an example sometimes in some of my talks is, okay, here's what this practice says that they are committed to,
Yeah.
but it's not being fulfilled from the clinical standpoint in the hygiene department. And so that's helpful because then you can say, okay, how do we close the gap? It's not an accusatory, it's not a shaming kind of thing. It's like we all want to we all aspire and want to deliver on these core values, but there are some obstacles in the way, and so we help them work through those.
I hear both of those are great examples. I'd like to dive into them a little bit.
Sure.
The first really is about how do I get my team on board? Like I've tried some things, I have an
Yes.
idea, I kind of think I know a little bit of what I want to accomplish, and how do I get my team on board? And you mentioned part of that is you can bring some evidence, you can bring some expertise
Mhm.
to it. It's not this
Yep.
dentist just being greedy saying, I need
Yeah.
you to do this. But
Right.
you're like, hey, there's a reason why we do this to take care of patients. So
Yes.
what do you find is that motivation? How do you help get people on board? Is that it? Is it just a matter of, hey, look, this is how we take better care of patients?
I think it's a focus and it's a multi-pronged focus over time. So, I think so often we expect that the team is going to just respond and show up and say, "Oh, okay, we didn't know we were supposed to be doing complete perio charts. So, yeah, of course we're going to do that tomorrow, and then it's going to be done on every patient." Change is a process, and that's what we're talking about here for these teams is workflow change, mindset change, how they're communicating with their patients is going to change. So, it can be frustrating when everybody agrees and then nothing happens because so often the team is not aware of what the obstacles are or aware of all the layers of change that need to take place in order for this to really work. And so
Yeah.
first, in my opinion and experience, is the mindset change. Is Okay, so we're not saying that we were doing a bad job prior. It's just, hey, we want to do an even better job. So, how do we build on what we already have in place? And so it looks like bringing evidence, like you said, of what is, how do we create a standard of care? We teach and we help facilitate creating a written standard of care in the practice that everybody believes in, right? It's a collaborative effort. Everyone agrees to. And then once they agree to that, if it's not being implemented consistently, then we have to go back and find out, okay, what is the obstacle that's in the place of implementing and executing on the standard of care that we all agree to? Um, but that requires setting those standards, and I have found that it is more successful when you do have evidence, whether that is a research
Yeah.
article on the oral systemic links, something from the AAP. I have a giant perio textbook on my desk right here that I use as evidence and as authority, right? So that there's multiple layers of like, this isn't just me making this up. Like, there's authority behind these recommendations. And I think the biggest thing that shifts mindset is really helping the team and the hygienist in particular recognize the potential impact that they can have on patients and really seeing like these are people that you have relationships with. Do you, if you had a relationship with someone, would you want them to, and there's something that you could do that would help reduce their risk for type 2 diabetes, would you do that? Yeah, of course you would.
Yeah.
And they were willing, and they've got to be willing to accept it. So, like, think about my spouse. If I know that, um, not drinking diet soda is going to improve his health and reduce his risk for type 2 diabetes, like, I'm going to say something or share a piece of information with him about that. It's up to him whether he takes that or not. Uh, but I wouldn't withhold that or wouldn't be afraid, in my situation to be able to share that. And I don't know if that's the best analogy, but I think it's establishing the why. Why is this important and why are we obligated really to share this information with our patients? And then how do we do it from a workflow standpoint, from a standard of care, from a team calibration standpoint?
I love when you start, like you said, with a common why, everybody's bought in. Everyone has said, this is our standard of care. This is how we want to do it. And once everybody's bought in, that in some ways, that just says we're all on the same page. Nobody's out to get anybody. Nobody's trying to sabotage the system. And then when
Yeah,
you see the numbers that aren't happening, it's just a matter of like tactics. It's like, okay,
right.
I get that this didn't work. I know you want to make this work,
Yes.
but it didn't. So what's the resistance? Is it time? Is it that
Yes.
after three or four insurance claims are denied, we decide not to do it anymore? Like, or
Yes.
what is the resistance? And then it's just a matter of, okay, now we
Yep.
can have some strategies around the resistance, but everybody's on the same page. It's not
Yes.
pointing fingers at any one of us.
Right. And then if you do drill down on all of that and then someone finally reveals, I'm just not sure I believe in this. Then even with that, then you can figure out, well, what would it take to for you to believe in this? What is the part that you
Yeah.
don't believe, and then you can figure out from there. You've done That's a lot of effort that you've put forth at that point to bring everybody along, right? And to give
Yeah.
everyone the benefit of education and support and listening and all of that. If at the point that you have that conversation, you just realize, hey, we are not aligned philosophically from a clinical standpoint, then that's where you may have to make a decision of, this is not the right person on this bus.
Yeah. Yeah. I like that. Yeah. And then you make sure you've got the right team. Everyone's there.
Right. Right.
Yeah.
For both parties, right? For all
Yeah.
parties to feel like they're in the right place.
And I love that you kind of just mentioned quickly, but it is something that's really key and core to initiating all of this is an accurate perio chart. Like I think
Mhm.
all of us think that we're doing perio charting, but are we really perio charting? Like, are we getting the details? And then
Right.
that that can be part of the resistance. Part of that is a time resistance. Maybe I don't feel like I have enough
Yep.
time,
Yes.
or it could be if they're not accurate perio charts and we're getting some insurance resistance, that's probably why.
Mhm. Mhm. It could be that there are multiple hygienists in the practice that are not, doing recording the measurements the same, and oftentimes there's the dentist is recording them differently than the hygienist, right? So,
Yeah.
getting them calibrated is a huge part of our coaching process, and then it's tedious, right? Let's be honest. It's a very detailed procedure, so, just making sure that there's support for the hygienist, whether that is voice charting or a team member that's helping, particularly when it's a very detailed and complex perio chart that they're trying to collect. Those things are super helpful.
Yeah. And then, we all talk about numbers because we get statistics. We say, okay, we know that 30 to 40% of the population has periodontal
Yeah.
disease. And so if you're in the 5% of your procedures are
Yes.
periodontal procedures, you're a little bit off, right? And that's an
Yes.
obvious one.
Yes.
But once I found that with my clients and even with myself, getting up to the 20% starts to plateau. Like I
Okay.
have a hard time getting all the way to the 30 or
Okay.
40%. What are your thoughts about that? And what do you see in the practices you work with?
Yeah. So one point of plateau is, and it is common for practice. Let's say they're at 10% perio now, and they say we want to work with Inspired Hygiene. We work with them, and they see a huge bump. There's going to be a huge bump in therapy in the first 6 months of implementing something new, right? Because now you're uncovering, patients that have disease that maybe you weren't looking at them the same in the past. So then how do we keep it from plateauing? There is going to be some natural plateau, but also taking a closer look at new patients. The one thing that we find with practices that have worked on their perio protocol over a number of years is what will happen is they may not be stuck in the prophy trap. So, like, their prophy patients might be, they might be very successful in getting them into periodontal therapy, but perio maintenance sometimes is where folks can get stuck. So then all of a
Mhm.
sudden we become blind to these perio maintenance patients that are showing up and they're bleeding every time in the same places. And we've just accepted that that's the way it is. And it doesn't necessarily mean that they need to go back through scaling and root planning all over again. That might be in their best interest, but it could be that there are other adjuncts or things that could help them, or maybe there's something going on with their overall health that we could bring up that would help, create a resolution. So that's something, kind of the second level, right? First level is really just implementing this and everybody getting on the same page with the protocol and getting patients healthy. And then the second level is, okay, what about these patients that are relapsing? What do we do for them? And that can help kind of unlock that next level, whether that is pathogen testing or adjunct services that can enhance, scaling root planning, or that can address some of those chronic inflammation issues.
Yeah, I love that. And there's on the other side of that. So, you talk about because we put people in two camps. They're in the maintenance and the prophy camp. And then they just stay in those camps and they stay in
Hmm.
those
Hmm.
lanes. And, we may see somebody transition from prophy to, perio if things got real bad,
Yeah.
but it's those borderlines. So you're talking about, our maintenance cases that just aren't responding or that we need to try
Right.
something different. We need to
Right.
advance
That's right.
them. And the same thing with the prophy cases. And we now have, our gingivitis code,
Yes.
the 4346, right?
Yes.
That a prophy in the presence of inflammation code, which kind of is that same way. Like we're starting to see some shifting towards this. Let's get you back
Hmm.
into your camp. And if we can catch those early, and that can make a huge difference.
It can, because then you can save a patient years and years of perio maintenance and, bone loss and all of that if it's being addressed early for sure.
Yeah, I love that. Now, the other going kind of way back, you mentioned, a couple of um, maybe a reason somebody's going to reach out to you. One was numbers. They're seeing
Hmm.
increase in the costs for just all of our team members, right? So
Yes.
overall wages have gone up, and
Yes.
certainly in hygiene. And if we haven't seen our production go up, our numbers go up, then our margins get really, really tight.
Right.
And so, um, do you have like percentages, or do you even look at that where you say, okay, hygienists should be producing a certain percentage of what you're paying
Yes.
them? Do you kind of look at some of those numbers, or do
We
you,
do. We do absolutely look at those numbers. So I would say a general two numbers is what is the percentage of hygiene production versus total office production, and that has shifted. I would say in the last 10 years with more general dentists doing specialty type procedures.
hmm
So and one thing that we often see is dentists who are very committed to high levels of CE, bringing in advanced procedures, and then but then you can't do everything at the same time, so very often the hygiene department kind of gets left behind. So they're doing 1990s dental hygiene while the dentist is doing 2030 dentistry. And there's a disconnect there, and so that hygiene production of total office can get out of whack there if that's the case, right? So
Yep.
the general benchmark is 25 to 30% of total office production is hygiene, but again, there's a wide range of variances with that now because of just a lot of
Right.
these specialty type procedures that the dentists are doing. The other thing we look at is that profitability ratio. So the general benchmark is that the hygienist should be producing in net production, so collectible production, 3 times their compensation. And you can look at their hourly rate as a really easy way to do the math. $50 an hour times 3, they should be producing $150 an hour. However, if we really want to get specific, it's also including their benefits as part of their because that is part of the compensation. So you
Yeah.
really want to just decide how specific do you want to get there. And but yes, we do look at that when we do our hygiene growth roadmap. And there are multiple ways, right, to get those numbers to match up better and to get to that first point of profitability.
And are there areas in the country where just because of the marketplace, it's hard to get that ratio where you're like, okay, look, you're going to end up you're not going to be as profitable in hygiene if you want to have a hygienist.
Yes, and interestingly enough, I never really thought about this, but this popped into my mind is some of those places, like if we think of Southern California or certain parts of Colorado where the wages are very, very high. I mean, we're talking, over $80 an hour. They also happen to be some of the most competitive markets. So it's not uncommon then for those dentists to accept a lot of plans, right? Be in network with plans because they feel like that's what they need to do to be competitive. And that might be the case. And so then they've got these really high wages and low reimbursements, and it really does put them in a tough spot. So there are times when a dentist practice owner may say, you know what, the hygienists are at 2 to 1 now, which means their production is covering their compensation and it's covering the overhead, right? So overhead for hygiene is equipment, instruments, disposables. Um, if you really get picky into it, it's the how much time is the business team spending filling the hygiene schedule and keeping that full? All of
Right.
those things. But if we could get even to 2.5 to 1, that would be a huge improvement. So
Yeah.
there are some instances where it is very difficult to get to that, but I don't want to say it's not possible. I don't ever want to give up on, the
Oh no.
possibility.
Now there's this balance, right? Though when you get in those practices, those are the extreme practices and where we're really
Yes.
trying to make this work.
Right.
And there's two ways to look at that. One is that, if you got a 2 to 1 profitability, like they're covering themselves, like you're
Mhm.
paying for the department. That way I get to do all the procedures that are coming out of there, right? So
Yes.
it's still
Yeah.
working for me as a dentist because I'm not doing the hygiene, I'm doing implants and I'm
Yeah, and
placing,
it's
I'm doing the other
yes.
things, right?
Yes.
And so there's that way to look at it. And then, but we also want to make sure that we're not losing money on the department. And where there's a shortage, there's been a number of different strategies. And so,
Yeah.
um, I have me personally an associate because it's not even a compensation challenge. It's just a matter, it's a small town and there is nobody to hire. And
Mhm.
so my associate's doing some hygiene and we've
Yep.
got strategies around doing that. Um, what I wanted to ask you though, where there's those shortages, so they're just as tough to hire,
Mhm.
and where, or in those areas where the compensation is really high, you've got 80, like you said, 70, $80 an hour. Um, there, we've got to find this balance where, um, how much do we have them see patients, the assisted hygiene or double
Yeah.
booking versus we also want you to be thorough and
Yeah.
periochart
And
and
do quality care
do
for sure.
quality care, right?
For
And
sure.
so how do you look at that balance? And what are your thoughts about assisted hygiene or making that work?
Yeah. I have worked assisted hygiene, so have several of our coaches, and we feel that there is a very high quality way that it can be rolled out. In fact, in 2020, early 2025, we're going to be releasing an assisted hygiene online boot camp to help practices that want to implement that find a way to do it that preserves quality care. So I've seen it done both ways. I've seen it pack in the schedule to where the hygienists are running 2 or 3 columns with an assistant and there's no space anywhere. And that it can work. It is not my preferred method of assisted hygiene. I think it
Yeah.
creates burnout. I think it makes it very difficult to have, make meaningful relationships with patients. But there is a way to do assisted hygiene that can work very well. Just think about assisted dentistry, right? I mean, dentists have been working with dental assistants for a long time, and it happens to work really, really well. So the same can be true for hygiene. We always look at several different things. So one is the practice in network? Are there any plans that um, are just frustratingly low to them? And is it time to release those relationship with those plans? That often will also free up space then for some growth in the hygiene department with regards to increased number of procedures that are happening if they're going to increase scaling, root planning, and that kind of thing. We also look at the service mix. Is it primarily prophy and bite wings? Because if it is, that's going to be very difficult to get to. It's going to be extremely difficult to get to that 3 to 1 profitability point if you have low reimbursing plans and it's a prophy bite wing hygiene department, and that's all there is.
Yeah.
The only way in that model to increase production is to increase the volume of patients that are coming through. And what we have seen is that the less time that the hygienists have with patients, so when you start shortening to 45 minutes, 40 minutes, 30 minutes, the first thing that goes out the window is diagnosis, because now all it's geared to is just get this prophy done. So that not only hurts hygiene long term, it hurts the patient, it also hurts the doctor's schedule long term. So, looking really more at expanding hygiene services, possibly looking at assisted hygiene, really looking at what are the reimbursement rates. Doesn't mean that you can't have a successful hygiene department in a PPO centered practice, but how can the mindset of the team also shift from being insurance driven to insurance friendly? And because it's, we can say all we want as an industry that we don't allow insurance to dictate treatment, but I see it all the time. Like literally come out of team members' mouths. Well, we can't do that because their insurance kind of not going to pay for that. Then that is literally letting the insurance company decide what you're presenting to patients. Now, we can be insurance friendly and still present what we feel like is in the patient's best interest. The other thing I will say on this topic is, even if the hygienist isn't at that 3 to 1, what if they're at 2.7 to 1, but yet they're an amazing diagnostic partner, and they just
Yeah.
tee up treatment, they build confidence in the doctor. The doctor really has very little to do when they come into that exam. Everything is ready to go. There is a huge amount of value in that.
Yeah, I agree. And I personally have a hygienist that's right exactly like you said, 2.5 to 1, but is just a rock star for
Yeah.
helping me with patients,
Yep.
keying up patients. That's the easiest exam I do because it's already done when I
Yeah.
walk in the room.
And
And so
also
it's
like
just
building
so nice. Yeah.
relationships, being a great
Yeah.
part of the community. I mean, there's other
Yeah.
points of value there.
Right.
That is a very measurable benchmark, right? Some of these others are not as measurable, but that is a
Mhm.
very measurable benchmark. But then don't let that be the one and only thing that you're looking at. Like have that holistic
Yeah.
view of the value there.
You mentioned a little bit about creating space, and I think that's some place where we as dentists get in our own head. What happens is we will be, we won't have enough hygiene days,
Hmm.
right? So based on our patient base, we don't have enough hygiene days because, and we think that our hygiene is not very full because we have some cancellations the day before. So we see a
Hmm.
couple of empty spots on the hygiene schedule each morning
Hmm.
and think that there's no way I need more hygienists or I can't
Yeah.
open up more time. I'm just going to be throwing money away. And
Yeah.
we don't realize that we need to have access to care or we can't diagnose. I mean, it doesn't make any
Right.
sense to
It creates a,
diagnose perio
yes,
and I'll see you in 6 months.
right. It creates a mental and a physical block if there's not the
Yeah.
time there. Yeah.
Yeah. And so I don't know what numbers you look at, but I love to see Um, at least at the 3 month mark, I like to have pre-blocked for new patients and
Yes.
perio. And so I like to see about 85% of the schedule full
Hmm.
in that like that 2 month, 1 month
Hmm.
mark,
Hmm.
and then be filling those up as you
Hmm.
get closer to the day of. But even day of, like if doctors tell me, well, I have like, 3 or 4 open hours in hygiene, I'm like, that's fantastic. I love that. You've got place to put somebody.
Hmm. Hmm. For same day. Yeah,
Yeah.
it is, I get it. It is stressful when it's last minute and maybe you don't have time to get somebody in there, right? So that becomes really frustrating. But yes, I would say 15% honestly looking forward is the minimum amount of time I would suggest having open.
Yeah.
Now, if all you do is have open time and you don't really refine your other processes,
Right.
then you might feel like, well, that's all we're doing. Like, what are we doing to fill this time, right? So what we notice is even having as much as 30% open in the next few months, or even next month, because we really don't want a new
Nice.
patient, if they're coming through hygiene, you really want them to be able to get in within 2 weeks.
Yeah.
Scaling root planing patient, yeah, same thing. If we're telling them they have an active infection, that's ideal. So if we're looking out 2 to 4 weeks, I would say 30% open time is really when you have a very active periodiagnosis and enrollment system in hygiene. Then you can easily fill that. And I know that makes folks nervous, but what we always tell them is look, you can always release the blocks, and put
Yeah.
patients in there, but you can't put blocks in when the schedule's full of profies. So you can always change if you see that, hey, we're not filling these blocks 2 days out, then make it 4 days out. You can always adjust when you release those blocks. Just have a conversation about it with the team so everybody's on the same page and it's not one person that's releasing and filling all the blocks and then other people are getting upset. It's just have a team conversation about that,
I
whatever the
love that.
method is.
And I love it when I get nudged. So when me personally, I have all the time, I create my own little ceiling or my own little like beliefs and I limit myself and say, this is about the right amount. And so I love it when I get nudged. So I love being nudged to 30% where I'm thinking in 15, you're like, wait, 30 is actually better. 30 is ideal. So that's fantastic. I like to be to see that vision and to see, yeah, that's actually, you can do more. There's better.
Mm-hmm. Mm-hmm.
That's
Yeah,
great.
it is interesting how, practice owners will say, well, our goal is, 40 new patients a month, and the majority of those patients go through hygiene. But I look out, 3 months, and there's, you know, room for 5 new patients. And I'm like, this
There's
is
nowhere to put them.
disconnect here. There's nowhere to put these patients. Yeah.
Yeah. Yep. What are challenges for hygienists? I'm so dentist focused. I know what the dentists are worried about, and they're worried about the rising, costs of hygiene. They're worried about open space in hygiene. So the big stressors for the dentists that I talk to is that they feel like their hygienists aren't producing what they're paying, right? So
Mm-hmm.
that's the big stressor. And we've
Mm-hmm.
talked a lot about that. What are stressors for hygienists? What are their worries?
Mm-hmm.
What's their anxieties?
I was just looking at some data on why hygienists have left the industry. There's a lot of reasons for that. I think one is there are a lot more opportunities for hygienists outside the clinical operatory now than there used to be. That's one thing. With an increase in wages, then hygienists can afford to work fewer days. Dentistry and dental hygiene and any role in the dental practices, it's taxing physically, mentally. Um, and then I also think another thing that showed up really strong in some of the ADA's surveys was culture. Just feeling like they're not in a healthy practice culture. We see amazing practice culture in a lot of our clients, and we see some that is I'll give an example of a practice that I talked with this week. Um, the dentist and practice leaders tolerating really bad behavior from members of the team. And that, you may think that doesn't, that you've got, well, these are our rock stars and these are the ones that like they're filling the seat and they're, but really bad behavior, like really like resisting incorporating anything like patient financing or any type of new software, just blatantly resisting things like that. It's not it's not only hurting the patients, it's hurting the practice, and it's also affecting your ability to retain really solid team members. So I think culture is a big thing, and I would think, Mark, that that's something that you really work with your clients on, is to create something that everybody's happy to go to work. We all love our days off and our time off, but if we're going to work, like, let's go somewhere that we really
Let's make it
enjoy and is
amazing.
fun.
Yeah,
Yeah.
let's make this amazing. And
Yeah.
and you mentioned, we think of bad cultures because we hear of like the tyrant dentist, and that's what we think of as bad culture, the throwing instruments or the
Yeah.
yelling, and
And that's a
and they're
thing.
out there. There are
Yeah.
those, but we forget that a tolerant culture can be just as bad, where we
Yeah.
just let everything go and we have no
Yeah.
control. Yeah, it can be just as terrible to be in.
Yeah, and a lot of times the dentist is just kind of given in to that's the way it is, and that's not okay. So I do believe that there is a shortage of dental assistants and dental hygienists, particularly. However, I do not believe that that should be a reason that a practice owner keeps a team member that is not aligned with the culture, because just I mean, you're not going to be able to fill that space with a right fit team member if it's being held by somebody that's toxic. It's just not.
Yeah.
So, very often, and you're not going to typically be as proactive, or that's my observation, not as practice leaders not being as proactive at hiring if there's someone that's filling that spot, even if they're not ideal. They're like, well, we put an ad out, but we're not really doing anything about it. Whereas if you know
Right.
that there's going to be an opening, like you're going to
You're
get
going to
on it,
work hard
right?
to find the right
Yeah,
person.
you've
Yeah.
got to be proactive to find the right person. Gone are the days of just like putting your ad up on an Indeed or a dental board and just expecting to get, 5, 6 applicants. It's not that way anymore.
No.
It's definitely
And
not, it's
we need to
necessary
be one, we need to have that culture that people want to be in.
and
And
attracts
then we
people.
almost have to market that culture to other
Yes,
employees like we would market to patients and say, hey, this is the
100%.
place to be.
100%. Because your current team members are going to be telling the people that they know, like, this is an amazing place. Also,
Yeah.
social media, right? You've got a huge
Yeah.
platform to show, like, we went out and had a great team lunch. We did a give back day. Like those are things that you're doing, and then you can share that you have to market for team members just like you're marketing for patients. Yeah.
I love that.
I would say
What?
with the same level of enthusiasm.
You're right.
Yeah.
So you mentioned one thing, and that is kind of as you're looking forward to working a little bit more with some strategies with assisted hygiene. What are you excited about in dentistry right now? What are you looking forward to in the next little while?
Yeah, I'm excited about the technology that is upon us. I mean, really, honestly, I would say the last 5 to 10 years, there's been more game-changing technology than there has in my entire 30-year career combined. And it can be a lot, right? And um, leaders like me who are like, "Oh, let's do that, let's do that." That can be overwhelming to team members too, like too much at one time. But I think really the technology is going to take our ability to care for patients to such a higher level, and also to treat active disease to help patients be healthier overall. I think that the awareness of the oral systemic link is much more understood with dental team members. I mean, we still have dental team members that are like, I've never heard this, but that's less common than it was 10 years ago. So I think there's more of an understanding there. I think there's more of an understanding in the general population about overall health and oral health and how it affects that. So I just am excited to see more and more hygienists step up into that role as true healthcare provider, and just really embrace that and just bring a ton of value that exceeds any expectation that the dentist and the patients have of them. And there are a lot of hygienists out there that are doing that.
I love that. Oh, well, I have to say, I'm excited about hygiene. And, that
Thank
does
you.
not too many people say that. I'm super
Yeah, you're
excited.
right.
This has been a blast. And I'm just excited about the future of hygiene because that isn't the sentiment generally. People are scared about the rising costs and the decreased
Mhm.
compensation and the tighter margins. But I believe so strongly that we want to support our team. I mean,
Yeah,
there's culture that we create, but part of that culture is compensating our team well so
yeah,
that they really feel appreciated.
yep,
And I love that you've showed that we can do that and still be profitable in our hygiene department. So that's
yes.
exciting. So thank you so much for coming on.
My
It's
pleasure.
been amazing visiting and talking all things hygiene.
Yeah, thank you for having me.
You bet. All right. We'll talk again soon.